Hey everyone, welcome back to this free Biomimetic Dental course, and today I'm going to be covering how Biomimetic Dentistry can avoid root canals. And this is one of my favorite subjects. A lot of patients are very concerned about preventing root canals or how they can avoid getting them, and I couldn't agree more. It's very important, and Biomimetic Dentistry definitely can help you avoid those things. So let's go ahead and understand what a root canal is and then how we can avoid it. So basically, a root canal means removing the nerve and the blood vessels from inside the tooth. We've talked about in previous sections how the middle of the tooth, called the pulp, has the nerve and blood vessels, and if it becomes badly irritated from like an infection or even from drilling a lot of tooth structure away, then there's no chance for it to recover. Unfortunately, the tooth cannot heal itself that well, and if the inflammation is bad enough, it loses circulation. And the bacteria creates that inflammation, which helps lose circulation, and then the tooth needs to have a root canal. So in the root canal, we remove the nerve, we fill it up with something that prevents things from getting back in there, and when that's filled and sealed up, the goal is to not have further infection or irritation, but the tooth is no longer alive, because once you've had a root canal, you've taken the nerve out, that's it. So now you're just trying to keep the tooth, but you've removed its vitality. And while I believe that a root canal is acceptable when you have no alternatives, the goal is to avoid these. And Biomimetic Dentistry can cut down the number of root canals you get by about 90%, it's estimated, because by saving more tooth structure, shaving less of the tooth, and having very good protocols for how we treat cavities, we can avoid a lot of things that result in root canals. So in the root canal treatment, you basically, like here you have the infected tooth, you have the bacteria that's working its way near the nerve, and if you think about what happens, bacteria gets here, it has acid, and that acid starts irritating, causing inflammation, and what ultimately happens is you build up inflammation inside the pulp. That inflammation results in heavy pressure, because inflammation, in any part of your body creates areas of swelling, right? But the tooth cannot swell. So what happens is the pressure builds up, and this little area where the blood vessels and everything come in has to try to put new fresh blood and circulation into an area with high pressure. It doesn't happen. Instead, the tooth starts losing circulation and it starts becoming necrotic or dead, and then we have to remove it. And when we remove it, we have to clean everything inside there. So the goal is to come in, clean out the nerve, make sure all the bacteria is removed, attempt to sterilize it, but we can't sterilize a tooth. There's no way. The mouth is full of bacteria. The best we can do is highly disinfect it, seal it up, fill, and then do a final restoration, whether it's a crown or an onlay. Something has to cover the tooth to kind of restore its strength after all this has happened. Now, how does Biomimetic Dentistry prevent root canals? There's a lot of different ways. I'm going to focus on about 5 or 6 of them, and then we're going to go through them one at a time. So one of the key ways that Biomimetic Dentistry can save you from getting a root canal is by keeping more of your own tooth structure. Another way is to very accurately identify what is cavity and needs to be removed, as opposed to the healthy portions of the tooth that should stay behind. Another one is avoiding pulp exposure. Pulp exposure means when you are taking out a cavity, if you take away a lot in the deep areas of the tooth, you can actually expose the pulp or the nerve of the tooth, and by the time you do that, you've increased your chance of a root canal exponentially. So Biomimetic Dentistry aims to avoid that pulp exposure. Another thing that we do in Biomimetic Dentistry is called sealing the tooth. There's a whole concept called immediate dentin sealing, and it's a very important step because it minimizes irritation, it gives you the best bond to the tooth, and in turn these things avoid sensitivity and pain that can make a tooth very inflamed and irritated. And restoring the strength of a tooth, because just because you have a filling, like let's say a silver filling, or just because you have a crown, doesn't mean you've restored the strength of a tooth. But in the biomimetic approach, it becomes very important that we actually try to bring this tooth back to the strength that it had, so that with function and chewing, it doesn't continue to get irritated and result in problems that lead to root canals. And then that brings us to our last point, which is protecting from future pain, sensitivity, and recurrent caries. a lot of the times when you get a restoration, say a silver filling, when you chew and function and so on, it's more susceptible to cavity. And if a tooth keeps getting exposed to cavity, irritation, pain, cracks, you name it, it becomes irritated and ultimately just loses the battle, and then it has to get a root canal. So these are the numerous different ways that we can avoid a root canal with biomimetic dentistry. So I do want to draw attention to the fact, however, that biomimetic dentistry cannot reverse an infection or an abscess, okay? So looking at this x-ray, this whole dark area here, that's a big cavity. That's the acid that's dissolved the tooth, as we talked about in previous sections. It's created a lot of soft or missing tooth structure. And it's gotten so deep that down here, these two areas where the arrows point are showing you areas where there's actually an abscess or an infection around the root of the tooth. At this point, the nerve tissue is dead, so we can no longer, it's dead or it's partially dead at least, and we can no longer bring it back to vitality. This is showing you another schematic of that. So if you've gotten to this point, you only have two options. One is to do the root canal and save the tooth, or another option is to extract the tooth, and a lot of people are opting to extract. I personally don't believe in that approach, and I can spend a lot of time in a future section talking about that, but for now suffice it to say that biomimetic dentistry cannot reverse an infection or an abscess. Here's another example, same idea. This big infection right around here also, you know, when you get to that stage, this one had a crown on it. So you look at this tooth with a crown, somebody placed a crown on it, everything seemed fine. I don't see another cavity, but oftentimes just the mere fact of getting a crown, which means shaving a lot of tooth, results in pain and irritation. And if the tooth becomes dead, it eventually will have an infection and also need a root canal. Now we're going to go focus on some of these specific examples. So preserving more tooth structure. When you look at biomimetic dentistry, we've used this a few different times. This is the traditional approach, take away all this tooth. In the biomimetic approach, we're only going to focus on restoring that area. By doing that, we can save 30, 40, sometimes 50% of the tooth structure that would have been removed to do things the traditional way. So that's one very important way. And the typical preparation for a crown is shown over here, and in the biomimetic approach versus what you see over here with an onlay. We've saved a lot of tooth structure here in all dimensions, and that makes a huge difference. Okay. Precise caries or cavity removal, okay? This is one of my favorite subjects, and it's because what we do as dentists is we remove cavities, we fix problems, but unfortunately a lot of old ways of identifying cavities were full of subjective things, which meant, is this soft? Do I remove it? Does this make sense? Well, we don't need to do that. And two of my mentors here, David Allman and Pascal Monnier, who I've been very fortunate to have a lot of training by them over the years. They published an article that summarizes the ability to remove cavities, and these concepts go back to the 1960s, and I just want to draw attention to the fact that they're not new concepts, but not a lot of dentists practice this way. So the goal is to accurately identify what is cavity and what is not. So we have a special dye, and you put this dye on the tooth and it stains the parts of the tooth that have been demineralized or broken down and helps us identify what should and shouldn't be removed. I want to show you a case of how this works, okay? So here we have a cavity, and when we use this pink dye, we leave it, we let it settle on for like 10 seconds, and then we rinse it all off, and it stains the parts of the tooth that need to be removed. So let's look at this. Here we have the tooth. After we've rinsed everything off, you can see the portions that need to be removed. We start cleaning up, and then we do it again and again and again. We keep checking and removing until we get very deep down. And at some point, we have to know when to stop. And I'm going to explain that concept in a second. And we restore that with a filling in this case, or whatever restoration, but by preserving and avoiding a pulp exposure, and also by accurately removing just what's cavity, we minimize the chance of a root canal, as opposed to feeling and scrubbing and touching. That's really not an accurate way to feel for a cavity. That brings us to the pulp exposure, which I just hinted at, okay? So in this article, there's this whole concept that this is our nerve right over here, okay? So this is the area where we want to avoid taking away and resulting in a pulp exposure, because if we touch the pulp, if we start to see some red area where there's like pulp and blood and all that, then if we avoid that in the first place. So we have a way where we measure, and our goal is to have perfectly clean enamel, perfectly clean in the DEJ, which is the area I talked about before, and then perfectly clean in the dentin, but in the deepest portion of the tooth. When we get to a certain depth, whether it's from the top down or from the side in, at some point we want to stop, and instead of removing that portion of the tooth, we want to disinfect it. Even if it's a little bit softer, we give the tooth a chance to stay alive when we do this. So instead of removing, we can actually leave that and seal all around it, because remember, bacteria need carbohydrates. And if we have a really good sealed restoration and we killed all the bacteria possible, then what risk do we have of a cavity or more problems? It's a very, very low risk. So this brings us to our next way that we can avoid root canals, which is sealing the tooth, okay? You look at a few of these different examples here, and the day that I prep a tooth, so on the day that you come in, we remove the cavity and we take care of all the important stuff, I also seal the tooth. You can see this nice shiny layer. So here's the tooth before the filling's out, here's the finished preparation, and then look over here where you see this nice shiny coating on there. That's sealing the dentin. The dentin has all these little tubules, and when you seal them, you prevent bacteria, sensitivity, you avoid cavities during the temporary phase where we're making your final restoration. So it has a lot of different advantages, and one of the most important is that by the time you come back to cement, doing this technique helps us stick to the tooth 400 to 500% stronger than other techniques. It's a very important concept that helps you get such a strong bond, and it makes sense if you're an engineer, but it's just important for you to know that doing this gives you some advantages immediately and also in the long run by giving you a very, very strong bond. So traditional fillings do not restore the strength of teeth. Okay, you look at this area here, this was a big filling, and that filling failed, and what happened was two things. A portion of it chipped away, but also down here, if you look at the bottom photo, we have a crack that formed in the tooth, okay? Because just because you had the filling didn't mean the tooth was now strong again. So it had a crack, and sometimes this crack can be a big problem that results in root canals, but avoiding these types of scenarios minimizes the chance of a root canal incredibly. Take a look at that crack. So it's starting right over here. What that means is every time you're chewing on the tooth with the filling, it's way more flexible, it's too weak, and it's bending and flexing too much, and this crack starts to form little by little. And then the last way that biomimetic dentistry helps us avoid the root canals is by protecting from future pain, sensitivity, and recurrent cavities. A lot of traditional dentistry has like a useful life. You get a filling, it's supposed to be good for 5 years. We know that it can fail again, but that's normal, it's expected. But each time you have another cavity, each time you have another problem, the tooth can only take so much irritation before it's had enough. With a biomimetic restoration, we want things so nicely sealed and closed off that there is very low risk of a future problem, and by doing that, it cuts down the chance that you're gonna have any future problems because the tooth isn't constantly irritated. So look at how much tooth structure is missing here versus how we restored this tooth over here, okay? So we've just placed an onlay right into that missing area. The transitions are so smooth, the seal is incredible, the bond strength is high, and by doing that we have a restoration that's going to last for a long time and prevent constant irritation to the tooth, which leads to the root canal. Alright guys, so this concludes our section on how biomimetic dentistry can prevent root canals. I hope you understand that it is absolutely science, there's no fiction about this. Doing these techniques has a lot of different ways that we cut root canals down by an estimated 90%. You ask any biomimetic dentist how their practice has changed since they've been doing these techniques, weeks and they'll tell you the number one thing they notice is that their root canals have been cut down drastically. So that's very important to you. It's a very important concept. I hope you understand that, and thank you for tuning in. We'll see you again in the next section and continue this free course on biomimetic dentistry.